The story of CHC isn't the story of a small organization that grew larger over the years. The real story starts big, with the simple but mighty proposition that healthcare is a right, not a privilege. And from that first moment, CHC has been growing to fit that clarion call for justice.
In the late 60s and early 70s, our nation was living through turbulent times.
Demonstrations for freedom and human dignity.
In 1972, the seeds of disruption were planted in Middletown, Connecticut. A small group of activists knew change was needed in the way healthcare was delivered. They saw how the current system left families bankrupt and denied care to many because of race, language, identity, and poverty.
At the core was an idealistic, headstrong, persistent young man, Mark Maselli, along with some equally determined students from Wesleyan University, Matt Vinicus and Jerry Tracy.
And others from Wesleyan, like Marcy Rhine and John Hickenlooper. They were fortunate that two community elders stepped forward to guide and mentor them. Jerry Weitzman was the grandson of a Jewish refugee who fled persecution in Eastern Europe.
And Reba Moses, the granddaughter of a slave who came from South Carolina to settle in Middletown. Jerry and Reba found this band of young people and joined their improbable and maybe impossible journey. Working together, they made a bold choice to create a board of directors that was majority controlled by the patients themselves. Who better to understand the needs of the community? It was a founding principle that would never be abandoned.
The first location of the free clinic was a second-floor walk-up with tie-dye on the walls, beaded curtains, and that slight scent of incense wafting through the space.
Yes, it was incense.
When they opened their doors, their first service was dental, thanks to a volunteer, Dr. Jack Greenspan. It was the first free dental clinic in the country, and they would soon add medical and counseling services. The new clinic was not without challenges from the establishment.
One day, there was a knock at the door. It was the state health department.
"Can we see your outpatient license?"
Maselli replied, "Do we need one?" They did. It seemed like the journey was over almost before it began. The state shut them down when they found the hallway was too narrow by 1 inch.
It was a devastating setback, but also maybe a blessing, because they found that last missing quality for a much longer journey: resilience. They picked themselves up, and with the help of the community, the elders, and their guiding principle, they opened up a new space in the north end of Middletown, with dental, medical, and behavioral health services, and very wide hallways.
50 years later, the Community Health Center stands firmly on the shoulders of those early founders and all those who dedicated their work and service to those in the community who needed it most. That first seed was planted, and it grew.
From that one site in Middletown, caring for only a handful of patients, the Community Health Center is now operating in 245 locations, providing primary care to 145,000 people, from Stanford to New London, from Clinton to Enfield, and all points in between.
They meet patients where they are, at 34 farms for migrant and agricultural workers, at homeless shelters caring for veterans, survivors of domestic violence, and those forgotten, and at 185 school-based health centers. CHC has always understood that care must be delivered where our patients live, eat, sleep, and pray.
And as CHC grew, new leaders like a young nurse practitioner named Margaret Flinter joined the cause, bringing their insight and drive, not just to provide health care, but to make it better. That's why Margaret founded the Weitzman Institute, to identify the best practices in primary care that would help not just patients here, but everywhere.
Now with offices in Colorado, California, and Connecticut, it's a nationally recognized research and training center. that last year trained 8,000 health professionals in all 50 states. These Weitzman programs provide e-consult specialty care, educate nurse practitioners and medical assistants, and train providers on the latest developments in HIV treatment.
From the very first people hired in CHC's early years, like Dr. Carl Lecce, still caring for our patients today, there are now more than 1,500 people working together to make healthcare a right and not a privilege. This new generation of leaders and staffers is a lot like the original founders, intellectually restless and charting a course for the future, always thinking about what's to come.
How else could CHC have met the challenges of the last 2 years? With a testing and vaccine campaign that reached over 700,000 Connecticut residents.
There's much to be thankful for. The determination to move beyond early setbacks. The providence that brought elders like Jerry and Reba to the young upstarts. And the immutable principles that have guided the organization that Margaret Flinter and Mark Maselli continue to lead. The clarion call that started CHC is being heard by a new generation. Healthcare is a right, not a privilege. That idea continues to attract bright minds, enthusiastic staff, and people like you to the cause.
It's a guiding principle that keeps us true. That's where we started back in 1972, and CHC has been working to make good on that dream ever since. Peace and health.